Welcome to NASH Therapeutics Study Streak for 14th August 2025. Welcome Dr. Akshita Khariwal and a few others on YouTube. This is NASH Therapeutics Study Streak for 14th August, and I am hopeful that you have started reading NASH Therapeutics, and if not, then it is high time that you should read it. Thank you for joining Jayu 711 Vijaya Vidyadhar. Today's session we will cover Pyrogen and Chenopodium from NASH Therapeutics, Leaders in Homeopathic Therapeutics by Dr. Nash. This is a book which inspires every beginner homeopath to excel in practice through materia medica snippets, through cases, through motivational talks by Dr. Nash as if he is sitting besides in your clinic. And it is very important that every homeopath goes through this book anytime he's down and out, demotivated, not inspired. This is the book that will give you the inspiration to live and propagate homeopathy in more power than ever before. So, we are taking this Leaders in Homeopathic Therapeutics, NASH Therapeutics, remedies from Leaders in Homeopathic Therapeutics, one remedy at a time, or some days five remedies, some days three remedies, based upon what Dr. Nash has given in the series of expressions that and the order which he has maintained. So we have not stuck to ABCD. In Allen's keynotes, we did relationship of remedies and jump to from one remedy to another remedy based upon its relationships. And same we are doing in Nash Therapeutics, but we are following the author's flow of thought because he connects one remedy to the other remedy and the group of remedies he keeps on expressing. So the remedies we'll discuss today, Pyrogen and Chenopodium. So good to see some of my people who are in Homeosetu Clinical Circle, and I hope joining the group has helped you sharpen some clinical skills and give you a new way to think about the usually prescribed remedies. So in the Homeosetu Clinical Circle, the Instagram and the WhatsApp group as well, we are posting some short cases which are on a daily basis required to be cured by a homeopath by regular routine remedies, but in a different way. So let's move on to today's talk about pyrogen and chenopodium. So pyrogen, Dr. Nash tells us that diseases that originate in ptomaine or severe gas infection. So this was a time when uh, many things were developing in Western countries as well as in Eastern countries, and there were sewer gases which were being laid down. People used to get affected by typhoid, by different sorts of infections. Pyrogen was one of the remedies which Dr. Nash thought works well in such conditions. He has not used this remedy himself. He claims to tell us, the reader, about it, but he tells us that Allen's keynotes is the most reliable, book for us to understand how and what. We all know that anywhere in the body, septic infection, we don't know why is it happening, how is it happening. Pyrogen is the remedy we can give. Puerperal and surgical causes or diseases originating from ptomaine or sewer gas infection should not be passed lightly over. And there are few clinical indications which every patient more or less will tell you, which is why this is one of the sheet anchors of prescribing in such conditions. One of the indications is bed feels hard as if lying on a log. This is also there in arnica. If the parts also feel sore and bruised, it's there in bacteria as well as in pyrogen. And if there is decomposition of tissues in the parts where the patient is lying or in any other part, the reason is unknown, or there is widespread septicemia, carbolic acid and pyrogen will do the work. So Dr. Nash gives us very beautiful insight into how we can use pyrogen as a remedy in simple indications that we are able to obtain from a simple book which is Allen's Keynotes. So good to see many people joining: Dipshika Singh, Payal, Kaur, Dr. Parvinder. I don't know who all you are online, but there is an option to see. But nevertheless, Nash Therapeutics is the book that every homeopath should read every year. Once in a while, it will you will finish it in 2 to 3 months. If you read one remedy or two remedies a day, if you read 5 6 remedies a day, it can be read. You can finish it in 1 and 1.5 month. So about pyrogen, restlessness is there like that of arnica, eupatorium perfoliatum, but here in pyrogen, the patient must move constantly to better the soreness of the part. So this is one of the very vital confirmations which we should have from the patient if we were to prescribe pyrogen. Do you feel better by change of position? Is if there is any pain in that part, do you feel better by turning to other side or the opposite side? If patient replies in the affirmative, yes, then the remedy to be prescribed is pyrogen. Now, the tongue is one of the very interesting indications which we always all rely on. And if you are not relying on indicated tongues, then you are missing out on something very interesting. Large, flabby, clean, smooth as if varnished, fiery red, dry, cracked articulation is difficult. So the tongue is also showing signs of what is happening in the body. That is what we should understand. What is happening on the physical level throughout the body is also happening in the level of tongue, or it can be vice versa. But the tongue is a valuable indicator. There was a Dr. Prakash Vakil who used to only prescribe on the basis of tongue. This is the acumen which homeopaths should develop. Observational skills should be mastered. In pyrogen, diarrhea is horribly offensive, like sorinum. So all cases of diarrhea which report to me, I always ask them whether it is smelling, whether it is staining, whether it is showing any particular color. Sorinum and podophyllum will give you offensiveness. So also pyrogen. Brown or black colors will be pyrogen and leptandra. And if it is painless involuntary, podophyllum is definitely indicated, but also aloes and oleander if the patient is not sure when passing the stools if he can control or not. And in all cases where there is septic fever, if you are stuck in a case of fever, you don't know how to go ahead, where to go, what to prescribe, arsenic, anthracynum, and pyrogen should be remembered. And horrible burning pains of the first two remedies are important. Pyrogen is mentioned in very short, 1 or 2 pages by Dr. Nash, but in bigger books you will find more literature. For the moment, we will stick to the book which we are referring, which is Nash Therapeutics. We will be taking up many books later on after the series of Nash Therapeutics, which we will end soon by this month end. We will take up maybe Blackwood or birth physiology, depending upon what content is favored by the audience. We will take a poll and start right away. Chenopodium is the next remedy, and very small remedy. It has case cured by Dr. Nash of left shoulder blade. So right shoulder blade is Chelidonium, left shoulder blade is Chenopodium. So it's like siblings or brothers, Ram and Shyam, which we always hear, Suresh and Ramesh, which we always hear in all the advertisements and all the Bollywood movies. Chelidonium and Chenopodium are similar remedies, left shoulder and right shoulder, we should remember. And if it is a small remedy, nevertheless, it is important if the symptoms are only of that part, one sided cases, which we always come across sometimes in our practice when patients don't speak. So he gives a very short synopsis of how Chenopodium has infrascapular pains similar to other remedies which have similar single spot issues. like inframammary pains in the climatic for simicifuga, or when the patient is nursing the child, the pain runs from nipples to the back, crotontic or cilicia. Meritus communis pix liquida theridion sulfur for left chest pain to the scapula. And if it is right chest, again cheridonium comes, Merck vivus and Kalikab. And if it is upper right chest, Calcarea carb and arsenic album. And lower left chest, then it is natum sulfur. So Chenopodium for all the pains in the left scapula, infrascapular region. You should think of ranunculus bulbosus is also another remedy which we can think of, but it should also have pains in pinpoint location and ribs which are affected. So I hope this has helped you all. All the NASH therapeutic study streaks are posted on our YouTube channel due to lack of space on the Instagram and Facebook portal, which we get messages. We have withdrawn all the videos. But if you wish to watch all the NASH therapeutics, log on to YouTube, subscribe to you Homeosetu YouTube channel, and you will find all the presentations with PowerPoint beautifully described. Don't miss this book in your practice. It's going to help you a lot. And keep following Homeosetu, which is going to enrich your homeopathic knowledge with different tools and video courses. And those who wish to watch some video courses from our learnings, for the moment we have posted 4 videos on our website. If you wish to avail any coupon codes to get a special discount for Independence Day, DM us and we'll provide it to you.